Isabella, Ann-Marie, welcome to the Working Wellbeing's podcast. We are going to be having a bit of an express chat this morning because I know you guys are very busy with networking and connecting with people here at Health and Wellbeing 2026. It's very busy here today, isn't it? There's a real vibe. And how great is it to be speaking to lots of people?
It's fabulous. It's fabulous to be somewhere where health and well-being is in the same sentence.
Yes, exactly. Yeah. I agree. And you guys, I'm going to hand over to you to do some proper introductions about who you both are. And I actually also want to touch today on your careers too, because that's a big thing for us is how do people end up in this space? Yeah. And you're from a coaching association, aren't you, here in the UK? So can you fill me in on what that is and what you're doing here?
Yeah, sure. Shall I?
Yeah, you start, yeah.
So we are here representing the UK and International Health Coaching Association. We're the professional body and a membership organisation for the relatively, not brand new, but relatively exploding onto the global market of health coaches. And representing the development of health coaching as a discipline, as a modality, quite different and separate from executive coaching or leadership coaching or life coaching, business coaching.
Yeah.
So our purpose really is to make sure that we put whole person health and well-being into every sector of society. You only have to look, I've got some stats with me, but you only have to look at the depressing news every day about the health of the nation globally, as well as, in the UK. But the health of the nation is declining. What are we doing about it? We're putting more money into, and I know that my colleagues in the health sector would agree, putting more money into reactive health care instead of proactive prevention. And that's very much what we're about, isn't it, Ann-Marie? Yeah.
Amazing. And are you both coaches?
We're both registered health coaches.
Yeah.
My former person was, I come from a corporate background.
Yeah.
I actually come from a long NHS background as a health research psychologist at the University of Birmingham Medical School, and then working for the National Health Executive in the training division, and then coming into organisational development in the third sector, and then training as a chef at the Ballymaloe Cookery School.
Wow.
When my 45,000 miles a year and constant hotel overnights nearly broke my health. Ann-Marie's got a not dissimilar story. And I trained as a nutritionist, and then I thought, actually, what I want to do is coach. And so I found health coaching. They asked me to come in, because of my academic background, to come in as Director of Standards and Professional Development, which I did with some trepidation, found my feet, and then quite shortly afterwards, I became the CEO. And everything I've done in my career has put me in this place now. It's a fate, honestly.
I love that. Yeah. We've been hearing a lot about that because we're always really interested in the careers. We want to hear about the work and the themes and things, but careers is also a really useful thing for our network to hear about, because everyone's coming to this from so many different places, aren't they? And often passion and a connection to a thing that you know that you're good at, or that you found yourself doing. So really good to hear that. I love that about Ballymaloe
Cookery School in Ireland.
I think my mother-in-law might have gone to that cooking school.
Oh, brilliant.
I think so, yeah. I don't know when she did that, but I've heard that in the family.
2010 was it changed my life.
Yeah.
Honestly, absolutely changed my life. I went thinking I would do Heston smears, and lift lids off smoking fish and stuff. But no, it was digging up the snow in January to test the soil, to be educated in the health of our soil determines the health of our body.
Wow. Yeah. So is that what was the gateway to the nutrition aspect?
Yeah. But then I realised actually I wanted to help people change what they were doing. So I did a small cookery school for a little while at home called Once Upon a Cook, teaching people how to source a real chicken, and what to do with it when you've got it home without it being wrapped in plastic.
Yeah.
Yeah, so that.
What a lovely experience.
Yeah.
Amazing. I want to come for dinner at your house.
Oh, bless you. Well, I have to tell you that our coaches come from every background. They come from corporate background, they come from business backgrounds, they come from mothers who've had health issues. They are lawyers, they are consultants in the NHS, they're ophthalmologists, rheumatologists, surgeons, oncologists, nutritionists, they're every kind of ologist. And they're all realising that adding health coaching into their portfolio of skills is the way that they make a difference to the people that they serve. And it is no different in corporate, is it?
Not at all, not at all.
Tell us a bit about you, your role and career and things.
Absolutely. So I started life as a corporate finance lawyer in the city, back in the .com.
Yeah.
So working crazy hours, working through the weekend. If you got home by midnight, that was an early night, that kind of situation.
But it's a rite of passage though, isn't it?
It is a rite of passage, and it was just
We hear that
normalised.
sometimes, yeah.
It's just what we all did. And actually we had great friends and great community, and we all supported each other. I mean, it was a sort of nice environment from that perspective, but sleep was compromised. I was eating 3 meals at my desk, croissants, Chinese meal at 9 o'clock, taxi home, trying to sleep, and, drinking my stress with alcohol. It's just what we were doing back then. I knew that law wasn't for me because I worried about it a lot. And then I moved into business development and strategy for law firms for the next sort of 15 years. But in the middle of that, I burnt out, collapsed on the floor, and ended up in bed for 18 months, mostly unconscious and unable to feed myself. And there's no pill to cure what I had. I ended up with chronic fatigue syndrome. And I just lay there thinking, if I ever get out of here, I will dedicate my life to helping other people get better quicker than I got better, because it took me nearly 15 years for a full recovery. Or ideally, as Isabella saying about the preventative, just not get that sick in the first place and actually recognise the symptoms and the signs earlier on that something's off, that your body's not quite right. So the moment came for me. I was finally fully recovered in 2023, and that's when I trained as a health and wellbeing coach. So I'm nearly 3 years in, went out on my own just last year, and I focus on workplace wellbeing, do talks, all that kind of thing, as well as one-on-one.
Yeah, and are you after the lawyers in terms of
Absolutely, the burnout and the capacity.
They need that relatability, and you're talking about the different backgrounds that people are coming from. That's what people need. They
It
need
makes
to
a
see
big
someone
difference.
like them,
Yeah,
and knows.
yeah.
Oh, definitely. And we have quite a lot of burnt out lawyers in the association as health coaches, because they've all found their way and realised that if only they'd had access to the kind of professional support that they are now able to give, they may not have got to the point where they had to leave the law.
Yeah.
And we've also had a big win, haven't we, recently with Law Care?
Okay.
So
Great.
we met Elizabeth Rimmer. We met her online a few times, and we impressed upon her that the mental health charity, but mental and physical health are two sides of the same coin. So you can't, we don't just come with a brain, do we, with mental things going on, and she very kindly supported us to write an article for Law Care, which Kate Moran, our other ambassador, wrote, and they've published it. And as to support lawyers, and we have another article in the process. So we're hoping to make some real impact on it.
Yeah, I suppose it's opening it up to people, isn't it, and sort of helping them to understand how this can work. And there's a shift, isn't there, in how people perceive this type of support and journey.
There's definitely more openness to it, and as Isabella's saying, there's been so much amazing work done on the mental health side of things, which is absolutely fantastic. But if you're absolutely physically and biologically exhausted, you can't mindset your way out of an exhausted body. You've got to feed it, you've got to sleep, you've got to obviously sort your stress levels and the mental health stuff as well. But it's got to be whole health. It isn't just, as you say, neck up. It's everything.
Cool. So I've got a few questions, and I'm mindful of our time, but first one's a little bit challenging, which is, I'm so glad to hear that you're doing this work, because what I've seen in this space is a lack of structure and blueprint in a way. And what do we do with that sort of Wild West aspect of people kind of calling themselves a health coach? because they're a yoga teacher. I'm a yoga teacher, by the way, and I love sharing support for people as part of the health, but I stay in my box and in my lane as a yoga teacher and don't go without that. Like, so what do we do about that for people who are vulnerable and they need support?
Well, we make sure that we get we've got a campaign starting, well, it's just started this year, called Take the Lead on Your Health. It's the first time the association's addressed the public, general public, like the people here, not corporate, not patients, but just everybody out there, to recognise how much they can do to take the lead on their health, but how important it is to make sure that you're getting that advice from trusted sources and from trusted practitioners. And so a big part, or the main part of the professional body aspect of who we are, is to set education and training standards, robust education and training standards, approve the providers that deliver that curriculum. So we set a curriculum, they have to meet it, and they're tough standards. And it's not just show us a course material, but who's delivering it, how are you going to monitor it, how are you going to QA it, how are you going to support the students, how are you going to assess them. They then come into the they come as students, they then progress to full members, and we hold the first register for health coaches in the world. We established that, I think it was 18 months ago. So they then move on to the register, where they have to uphold CPD requirement, supervision, annual supervision, continuing professional development, and of course there's a big community in respect to that. So they're part of a professional community, and our CPD and the work that we do in that community with them keeps them current, keeps them safe. They have to be insured. They have a code of conduct, and if they transgress, we monitor it. And I do write to coaches that are perhaps not promoting themselves quite appropriately, and guide them to maybe rethink what they're, how they're presenting.
But it's so important, because people are only, like, society's only going to benefit if there's a framework for this and guidance for this. Otherwise, people will suffer from the variation and the kind of the different pay models and the different kind of ways this is presented. And I think what we need is, we don't want to lose the innovation and the creativity that people have, and the different, like, places that people are coming from, and your, like, sort of unique spin on it. But also people need to feel safe, don't they?
Oh, absolutely. Absolutely. And I think when we're talking to, boards and, coming in and doing workplace health and wellbeing, they need that accreditation, that trust, that actually they've got someone that's registered and they're seeing that in us. So, it's ticking boxes quite quickly, rather than, I'm just doing it off my own bat. So that's very helpful in terms of our health coaches going in and doing that kind of work.
Yeah, so that was going to be my next question, actually. But okay, so this in the workplace, right? So, because obviously you're also operating outside of the workplace. But so why is the workplace so important for you, and what's your message to people? And I don't just mean the kind of law firms that probably have, like, more of the money in most cases to sort of fund this, but, like, what's your message to, I don't know, NHS organisations, for example?
Well, we do work a lot with the NHS. We've got a lot of NHS. We have a pathway for NHS health and wellbeing coaches. They're remunerated under the additional roles reimbursement scheme, but many of them come to us as the professional body. Their training is very different from the one that our coaches require, 600 hours. They have a much shorter training program, but now they have a staircasing program, which we've developed with one of the lead providers that is also one of our approved schools. And what we say, actually, for the workplace, if you would allow me.
Yeah, please.
People don't come as a job description, okay? They're interconnected and they're contextual. They bring physical, mental, emotional, lifestyle, familial, financial considerations to the work with them, and they bring their values. If we look at their health, the stats are that 2.8 million of us are economically inactive because of ill health between the ages of 16 and 24. 8 million working age adults report a long-term health condition that limits their ability to work or the type of work they do. Mental health, as we all know, is a leading cause of absence. 50% of us will receive cancer diagnosis. The other 50% will be their carers. Think about the impact of that on the workplace. 10.6 million employees are living already with at least one long-term health condition, which they are struggling to stay in work with, or they're worried to disclose it to an employer. And why would they, when their line manager would be terrified to hear this? Because EAP programs aren't going to support that. HR isn't going to support that. And it's unfair for us to expect them to do so. 1 in 4 UK adults report chronic pain conditions, and under about 28 million of us, a third of the population, live with long-term chronic pain. They're trying to stay in work. All of these conditions can be prevented, ameliorated, or supported at a stage where they don't force people to leave work. We've got the stats, we've got the data, the National Health Service promotes this all the time. We've got global data on the power of prevention before we get to the point of collapse. That's why we're here, and that's why we think that it's time for health coaching to be part of the conversation. Not to replace anything, not to replace HR or occupational health or any of the other functions, but to work alongside, making their contribution and supporting. And it's not just about coaches, it's about coaching. And we believe, don't we, that leaders, the board needs to understand, and we want to present this whole thing. I hope that's going to be the conversation with Matt. That we agree, it needs to be a governance issue. It needs to be risk. It needs to be asset. All of that stuff. But leaders need to be able to be helped to understand what is their role. What is their responsibility to their staff.
Yeah,
that's why we're here.
Yeah, and I think when you look at the fit for the future, and it's obvious that we just we've spent a lot of time talking and looking strategically, I think, like the sector, and look and research and evidencing the need, and that's really obvious to us all now, isn't it? But it's just let's circle back to some practical solutions, which coaching is one, that can actually just be an intervention and a solution at like shop floor level for workforces to help them. And we all need hand holding through experiences, don't we? And you can read and get expertise, but actually just to be guided by a coach is so valuable.
I think that's the big difference with health coaches. Like, we see so many amazing HR and wellbeing teams put these fantastic wellbeing programs together, and everyone's sitting there in the room nodding, knowing exactly what they should be doing and how they should be sleeping and what they should be eating and all of that. Like, we all know
to the max.
what we should be doing, but then they go back to their desk and nothing changes. And that's where health coaching really moves the dial in terms of getting under the skin. What are the challenges? What are the barriers? What are the behaviours that have to change to set you up for success to either reach that goal or make sure that, you being obese right now means you don't end up having diabetes or whatever the condition could potentially be. So it's very much sort of primary intervention.
Yeah, it's exciting.
Preventing it and not kind of, panicking. We've got a big problem. We've got to write big checks. And we're talking about symptom management, long-term sick pay, all of that. So it's right at the beginning of the cycle. But I think the challenge in the sector is getting these boards to actually invest in preventative, because it's very hard to prove. But for us health coaching, we've just saved X, Y, and Z. But it's definitely coming. It's definitely coming, and it's part of the Charlie Mayfield report. And people are beginning to understand that that's where we've got to focus now.
Yeah, I couldn't agree more. I'm all about the action, right? And just just doing some things. I saw something lovely this morning with Nicola Bullen, who's an occupational health specialist, and she was coming on the podcast. She was busy hosting, and she's sharing a whole stage for the entire day. She took a moment to take the sound guy a cup of coffee. She had about 2 minutes to spare, like barely, but she did that. And like, yeah, that's not necessarily, health coach isn't necessarily bringing you your coffee, but you know, it's like
So little moment, yeah.
it's taking action. And I think that's what a coach can help someone to do
Exactly.
and see clearly, because it's now, isn't it? We need to take action now with our health and how we function at work.
I think the other interesting thing that's a bit different about health coaches is, you know, we don't diagnose, we don't prescribe, we don't tell people what to do. It's a coaching process that enables them to make the decision themselves and to make the conclusion themselves. And research definitely supports that when people have actually figured it out themselves, they have a much higher success rate because it's actually come from within.
Absolutely. And it's personal agency, it's self-empowerment. It's this idea that I'm not so helpless as I thought. I don't have to rely on someone else.
Yeah, self-empowerment, you know.
Yeah. And it's also really important to, in this space, to just make a distinction between coaching and coaches.
Yeah.
You know, because coaches are the professionals, you know, and why are we different? Why are we different? Because we've got executive coaching, we've got business coaching, we've got life coaching. But what health coaches have is a huge underpinning health knowledge base. And that's very important. And it's a holistic, it's this whole person, which is why, you know, it's the biopsychosocial, emotional, spiritual, environmental,
Everything.
you know,
Yeah.
everything. So it's that whole person. You come to me as a client. I don't just see you as a goal for me to help you change your behaviour. I want to see you as you in your context. What is important to you? What is it that what's most important about your health? What is it that you want to achieve about this? And very often the reason you come or you present is not really what you want to change. And it takes a little while to uncover that. But if I don't understand what it's like to be living with obesity, to be living with a cancer diagnosis, to be living with stress, to be not being able to sleep for 2 years because I'm around the menopause or perimenopause. If I don't understand the physiological factors that influence your state of being. This is not being a doctor or a therapist or a psychologist. It's just understanding what that person may be feeling, going through, so that I can help them find a way that makes a difference to them in this coaching process.
Yeah, love it. Because there's no like one size fits all, is there?
We're not machines. We don't come in boxes, do we? You know, and everyone's got so many things going on outside of the office, caring responsibilities, children, ill health, whatever. So it's, you know, it's very personalised for them.
There's a real life cycle too, isn't there? So
Yeah.
anything that's, you know, like it might be about, you know, postpartum right now, but then the next thing is it's perimenopause. So it's also the journey of the whole thing and that inevitability to some
Constant
extent.
change.
Absolutely. From the cradle to the grave, it should be. And really, it should start before birth, shouldn't it, with prospective parents?
Yes.
You know, and then right the way through, you know, coaching families and, you know.
Yeah, there's so many ways that you can take, so many different kind of people that can be helped, isn't there?
A big part of health coaching role is to support people improve their health literacy, understand their bodies, A, but B, understand how to get access to the care that they need, how to navigate the systems and the you know,
That's huge, isn't it?
impenetrable.
Yes,
Yeah.
yeah.
And the other thing to say about there is no one size fits all, but it's really important, and especially in the workplace, group coaching is tremendously powerful. Because you've got peer support, you've got a facilitated environment, which is managed and supported by a trained professional, and everybody has got common problems. It's not about saying, "Oh, this worked for me, so why don't you try?" It's about allowing people to see that they're not alone in their struggle. No, I thought I was the only person that felt like this. And you're in a peer group. When that dynamic is properly and professionally supported, you know, you feel safe to
It's that psychological safety, say I'm struggling, or actually I've got that problem too. And I think where health coaches are really helping is, we can kind of embed ourselves in so many different ways. So we can be independent coming into a workplace and facilitating those group sessions, or there might be a demographic that needs some sort of one-on-one, so we can sort of do that. But we can kind of come in and support HR with their wellbeing programs in sort of a hybrid model, sort of a semi-in, semi-out, or be the sort of, the sort of external. So, we're not in competition with anyone. We're just another drop in the ecosystem that gets it all kind of going and improves everyone's health, and therefore productivity, happiness, retention rates, lack of absenteeism, all that stuff that board level really care about.
I love the idea as well that the group approach enables people to kind of just generally build awareness of the importance of this and build empathy and understanding of that humanness that exists in an organisation rather than happening in isolation.
Yeah.
And that goes beyond the group session then, because then they'll come out and they've got a kindred spirit, or I might work differently with you now because I know something I didn't know about you. And
it immediately changes the work relationship, just so you
Amazing.
know what's going on at home.
Yeah.
It works as bottom-up culture change as well.
Yeah.
Because when you have at least one, but maybe more, depending on the size of organisations, of these health and wellbeing peer groups, that's a ripple effect. People may not be part of that, but when their colleagues come back and, it's like, oh, it's FOMO, isn't it? I like to have we've done it in hospitals. It works bloody brilliantly.
Amazing.
With staff, with staff.
Oh, yeah. Amazing. I'm going to have to wrap us up. That was a really lovely chat.
Thank you.
But yeah, we could perhaps we need to come back for a second episode sometime.
We would love to. Yeah, absolutely.
Well, thank you so much for your time and everything that you've shared today for our listeners. It's been really, really interesting. And hopefully what we'll do here is, tag you into this episode so that people can connect you. People find you on LinkedIn?
Yes, they will.
Yeah, brilliant.
Yes.
And thank you so much for sharing this. I'm definitely going to be... I work for an NHS organisation. I'm definitely going to be seeing how I can get involved.
Oh, I have some news about, I won't share it now, but I received it last night, which you might be interested in. So,
Amazing. Yeah, let's chat.
Yeah. Stay tuned.
Thank you.
Thank you so much.
Have a good day. You're welcome.
Thanks for listening to this episode of the Working Wellbeings podcast. This one was recorded inside a Nook pod, and honestly, it was a game changer. Even in a busy event space, it creates that calm, one-to-one feeling that you can probably hear in the conversation. And if you want to find out more or get in touch with the team, there's a link in the description below.